The fourth wave is a wave of the unvaccinated, and kids under 12 do not yet have access to COVID-19 vaccines, and they are representing a larger and larger proportion of the total number of cases in Quebec and elsewhere in Canada.
Elementary and preschools in the Montreal area will have access to COVID-19 rapid tests, as they make up over 60% of Quebec's active outbreaks. If a class sees one positive COVID-19 test, St. John ambulance personnel will test the entire class as a preventative measure. The Panibo test provides results in 15 minutes, will be used for students but not for teaching staff.
When a student is already having some symptom, they will go to get tested on the regular clinic. And when that test is positive, this is when actually the school will contact the SUS, which after will contact us to test the full class. So normally, if they have the results in the morning, would probably be deployed the same day, but if it's at the end of the afternoon, would be the day after.
The test will be implemented in Montreal North, Park Extension, and Saint Michel areas of the city, where the vaccination rates are lower.
I think that every day, we see there's a new burden on our staff for COVID. I mean, don't forget, principal's got to run a school, a secretary is overwhelmed with work, the teachers are, and all the specialists. And so they weren't trained as medical technicians to give tests. Now, obviously they're going to do their part, but having an outfit like St. John Ambulance available is definitely going to be a plus. That's no question about it.
So rapid tests do come in as one way, amongst others, to help cut down on transmission within schools. And the approach that's being taken now, I think, is great. So in the sense that if a child tests positive, contacts of that child, so their classmates, will be screened by the rapid testing before they develop symptoms. So the idea being that if there was transmission within that classroom, we'll catch the cases before they themselves have a chance to transmit.
We have to have the parent consent before we do the test. And this test is not as invasive of the regular one. It's it's in the nose, but it doesn't go as deep as the regular test. So because it's for the elementary school, it's a test that shouldn't be a problem with them.
731 schools in Quebec have reported at least one positive case of COVID-19. Experts say despite the alarming numbers, hospitalizations for children remain low.
Certainly, we know the Delta variant is extremely transmissible, and it's been leading to a lot more absolute number of cases in people who are unvaccinated. Thankfully, the evidence to date suggests that in pediatrics, an infection with the Delta variant doesn't necessarily mean an increased risk of hospitalization compared to the original Wuhan strain. So although in adults, it does seem that the Delta variant is more virulent, in other words, more dangerous when you do get infected with the Delta variant, so far the evidence in kids does not seem to suggest that. So that's reassuring.
St. John Ambulance is actively looking for volunteers and staff to help with the new mandate. Head to sja.ca for more. In Montreal, Brittany Henriques, City News.